Do you often feel pain in your tummy? Is it the pain that tells you that you should poop? Or is it that you feel this pain and rush to the toilet but end up feeling like it was a false alarm? That could be IBS, also known as Irritable Bowel Syndrome. Today, let's talk about IBS and the top 10 IBS symptoms you shouldn't ignore. We'll also give you the answers to frequently asked questions about IBS you'd already be looking for, so stay tuned till the end. Let's begin with number 1 on our list: pain and cramps in abdomen. There's a sophisticated connection between the brain and the gut, and it's known as the gut-brain connection. In other words, any problem with the brain can affect your gut, and hence bowel movements. And good gut health is crucial for a healthy brain function. For example, stressed people often have difficulty with passing stools. So if you have IBS, you might feel butterflies in the stomach when you're nervous or anxious. Some people even experience symptoms of diarrhea when they're stressed. Anyhow, when you have IBS, this gut-brain connection may get seriously disturbed, making you feel tension in your abdomen. As a result, you might feel pain in the lower abdomen, but it may also extend to the whole abdominal region. You might also feel a bowel movement, and the abdominal pain may subside after you poop. It's also important to keep track of the foods that cause your IBS symptoms to get worse or trigger pain or cramps in your tummy. We'll also tell you about those foods shortly, so stay with us. Number 2. Diarrhea. IBS-D is the medical term for predominant diarrhea in IBS patients, and it affects an estimated 1/3 of all IBS patients. Besides showing up with usual symptoms like frequent bowel movements and loose or watery stools, diarrhea often becomes the primary cause of stress in IBS patients. People with IBS-D or diarrhea in general may experience more than 3 bowel movements per day. How many times a healthy person poop per week? You'll find the answer in the FAQ section of this video. Number 3. Constipation. IBS-C is the medical term for predominant constipation in IBS patients, and its symptoms include bloating, abdominal pain, and changes in bowel habits. People with IBS-C or constipation in general may experience less than 3 bowel movements per week. It's also important to mention that people with IBS may experience both constipation or diarrhea at different times. Sometimes they may feel constipated, and sometimes they may pass loose stools frequently. However, it has been observed that constipation is more common in IBS patients than diarrhea, affecting an estimated 35% of IBS patients. Number 4. Alternating diarrhea and constipation. The medical term for this condition is IBS-M, and studies show that it affects about 20% of all IBS patients. It happens when a part of food moves slower in your gut than the other. These inconsistencies can happen within the same bowel movement, resulting in alternating diarrhea and constipation. If you feel pain during constipation and diarrhea, it could be a sign of IBS-M, and its symptoms tend to appear more frequently and be more intense. It's often difficult to manage its symptoms, and patients with mixed IBS need to be properly diagnosed for it and given personalized treatment based on their individual condition. Number 5. Changes in bowel movements. Changes in bowel habits are one of the most common signs of IBS. It primarily happens due to the way your intestines balance the amount of water going in or being absorbed from the stools. When there's too much water in the stools, you might have loose stools. And if too much water is absorbed from the stools, it can result in constipation. Moreover, when you have IBS, you might even notice mucus in your stool. It's a clear sign of IBS, as it doesn't usually happen in functional constipation. You might also notice blood in your stool in severe cases, so watch out for it. Black or very dark-colored stool can be due to the bleeding in the upper part of the intestines, while red streaks in the stools indicate bleeding in the lower part of the intestines. So don't ignore this sign and consult a healthcare expert ASAP. Number 6. Bloating and gas. Another sign of IBS is bloating and gas. It primarily happens when food spends more time in your intestines, allowing the gut bacteria to decompose it, releasing gas and causing bloating. It has been estimated that bloating, gas, and abdominal cramping affect almost 80% of IBS patients and is more common in people who have constipation or IBS-M. To prevent bloating and gas, you'll need to avoid foods that trigger gas production, especially sulfur-containing foods like onion, garlic, leeks, and cruciferous vegetables. Number 7. Intolerance to certain food items. An estimated 85 to 90% of IBS patients report intolerances to certain food items, especially wheat, rye, and barley that contain gluten, and those that contain lactose, especially dairy milk. IBS triggered by these food items is different from food allergies, and it has been observed that lactose and gluten-rich foods tend to affect most IBS patients. So if you have IBS, you'll need to closely watch what you're eating and avoid the foods that trigger or worsen your IBS symptoms. Number 8. Fatigue. People with IBS often feel tired all the time. It has been estimated that around 60% of IBS patients feel extremely exhausted. Fatigue associated with IBS is different. It's not just feeling tired, it's like feeling too weak and a complete lack of energy. Number 9. Insomnia or difficulty sleeping. If you have IBS, you may also experience insomnia, or you may find it difficult to sleep. In fact, about 40% of IBS patients report difficulties in sleeping or having a short sleep duration. These symptoms can show up because of the disturbance in the gut-brain connection, abnormal bowel movements, and nutritional deficiencies. Number 10. Feeling stressed or anxious. Another common sign of IBS is that you might feel stressed or anxious very often. This can be explained due to the gut-brain connection as we mentioned earlier, and both stress and IBS go hand in hand. Stress can trigger or worsen IBS symptoms, while people with IBS tend to be more stressed than others. Here are some frequently asked questions about IBS. Number 1. How often do people with IBS poop? People with IBS may experience more than 3 bowel movements per day or less than 3 bowel movements per week. Less than 3 bowel movements indicate constipation, and more than 3 bowel movements indicate diarrhea. But remember that bowel movement frequency isn't enough to tell if you've diarrhea or constipation. In fact, a 2023 study investigated stool frequency in over 14,500 adults in the U.S., including healthy ones, and found that about 53% of them pooped 7 times a week, 30% of them pooped 8 to 21 times a week, and about 12% of them had a stool frequency of 3 to 6 times a week. But there's a difference between IBS-C and the typical functional constipation. Most of the time, constipation is temporary and can happen when you consume too many sugary foods and drinks, eat too much of a high-fiber diet at once, are dehydrated, stressed, or are taking antibiotics for a long time. That kind of constipation usually goes away with laxatives or avoiding the triggering factors. But constipation specifically due to IBS is frequent, painful, and often comes in an alternative way after diarrhea. You might end up having an incomplete bowel movement, causing you to strain harder, which can cause further complications as well. Number 2. Which foods to avoid with IBS? Besides gluten-rich and lactose-rich foods that we told you about earlier, there are other foods that you should be careful about if you have IBS. These include fried foods, beans and legumes, caffeinated drinks, and highly processed foods that contain added salts or added sugar, alcohol, sugar, and things that contain refined carbs like white rice and white bread are among the worst foods that can worsen IBS symptoms. You may also need to avoid certain veggies that are considered healthy, such as garlic, onions, and cruciferous vegetables like broccoli, cauliflower, cabbage, and Brussels sprouts. Number 3. What are the best foods for IBS? According to the NHS, people with IBS should eat oats regularly, particularly porridge. Eat around 1 tablespoon of flax seeds daily. Flax seeds are rich in omega-3 fatty acids that can help ease IBS symptoms. You can also eat almonds and walnuts for a healthy dose of omega-3s. Eat watery vegetables that are low in starch, like cucumbers, zucchini, squash, bell peppers, and tomatoes. Eat fruits like pineapple, papaya, avocados, bananas, and kiwi in moderate amounts. Bone broth and fermented foods like kefir, kimchi, and unsweetened yogurt can help balance your gut bacteria, reducing the risk of bloating and gas in your tummy. Lastly, consider taking inulin supplements as per the advice of your doctor, particularly if you have constipation-related IBS. Psyllium supplements may also be taken as they may help relieve both constipation and diarrhea in IBS patients. Thanks for watching and check out these videos too.